So I have also been doing a high intensity form of exercise as well. Do you recommend am I okay to carry on with that form of exercise? Should I lower the intensity?
Yes, there are different things that happen at different stages or trimesters, which are the thirds of pregnancy. And at the beginning, actually there's a hidden risk because people often don't say that they're pregnant, and because they're not showing, there's no physical way of telling that they're pregnant, they may not know themselves, then the hormones of pregnancy are already kicking in, and there are two in particular. One's called relaxin and one's called progesterone, and part of their job is to soften the ligaments, and so give your pelvis room to expand. Unfortunately, they do that everywhere else. They do that in your back, in your shoulders, in your hips, and so high impact exercise may be more damaging to your joints at that stage. And then later on in the last third of pregnancy, you've got all of those changes, plus the impact of putting on weight, feeling swollen, change in your centre of gravity, a change in your gait and balance.
I have noticed that actually. I do get off balance more easily.
And part of that is because your proprioception from your joints is altered by the softening of the connective tissue. So certainly in the last third of pregnancy, absolutely not a good idea. I think very few people would want to do it, but it's the interesting being careful even from the first trimester when it's not physical, it's hormonal. And you'll find things like you may have starting to notice that you can't take deep breaths, and that's because your diaphragm, which normally descends into the abdomen when you breathe out, there's not as much room for it to descend down.
I have noticed that actually.
So you can't, we use the term tidal volume, it's how much you can breathe out, and that reduces in pregnancy, particularly in the last third. It's the physical impact of your growing womb, and so you have to rely more on your side intercostal muscles. So you breathe more shallowly, you can't breathe for as long, you can't breathe as fast, and so very aerobic exercise is going to be difficult. But almost never say don't exercise.
No.
We absolutely want women to feel good, feel healthy. It's a way of making sure that you don't put on lots of unnecessary weight. It's good for constipation to keep exercising. So it's all good, but you just have to mitigate and modify.
Moderation. Yeah, definitely. I've been reading a little bit about pelvic floor exercise and how beneficial they can be. Could you sort of expand on any specific ways to be doing those to make them most beneficial for sort of preparation for labour and also for bladder control?
Sure. The first important thing to say is that people think of pelvic floor exercises as something that you do after you've had the baby, but actually you get far more benefit if you do it beforehand. And the pelvic floor is part of our core. So it's not just back and abdomen, it's also the pelvic floor. And there are lots of different ways of doing it. And whenever you get lots of different ways of doing something, actually it suggests that there's not one perfect way, and people will be comfortable with different ways of doing it. But the pelvic floor consists of both fast and slow twitch fibres. So you want to do a mixture of something which is sort of pulling up your pelvic floor quickly, and also holding it. Holding it's almost impossible because it's not a muscle that we.
I didn't understand, but I found something